Good day, everyone. I am Clarice, and I am here to share my knowledge to you about the teenage pregnancy and its effects on their families and as well as the communities. So, some 3.9 million unsafe abortions occur each year to girls aged 15 to 19 years old in developing regions. Adolescent pregnancy can also have negative social and economic effects on girls, their families, and communities. Unmarried pregnant adolescent may face stigma or rejection by parents and peers as well as threats of violence. In the US in 1980, there were 1,181,000 pregnancies involving adolescents 13 to 19 years of age. So there were 159,000 miscarriages and 460,000 abortions and 562,000 live births. Research continues to confirm the adverse social and economic and health consequences of teenage pregnancy. The long-term consequences include lowered educational achievement, medical complications, higher subsequent fertility, low labor force participation, reduced earnings, a lifetime of economic stress, and limited opportunity, and marital failure. So the long-term effect on the infant includes an increased incidence of both mental subnormality and neurologic problems. The majority of teenage pregnancies are unintended and linked to need for someone to love, ignorance regarding reproduction and birth control, and the growing rate of early sexual activity. So there is clearly a need for accurate information and guidance related to sexuality and family planning. In response, many programs have been initiated by schools, community, and church groups as well as the federal agencies to address the problem of adolescent pregnancy. It is suggested that home economies could spearhead a comprehensive grassroots approach to teenage pregnancy that would include the following steps. Number 1, conduct a needs assessment for the region. Number 2, network with various groups and individuals with similar concern. Number 3, unite concerned individuals and groups to prevent duplication of effort. Then, number 4, concentrate attention on acute needs first. Then, number 5, develop a lifelong educational program and determine methods of instruction for teachers, parents, teens, and children. Then number 6, encourage enrollment in home economics courses and programs that focuses on concepts such as self-concept, values, responsible discussion making, and the consequences of teen pregnancy. Then promote public policy number 7, promote public policy that would mandate a home economics family life course requirement in high school. So as we all know, teenage pregnancy is a health issue that has an effect on all of us. A child having a baby as a teenager is more likely to face critical social issues like poverty, poor education, risky behaviors that lead to poor health issues, and child welfare. So, it can also, the financial cost of teens having babies is financially devastating. Early pregnancy is one of the pressing issues Filipino youths are facing today. The Philippines has one of the highest teenage pregnancy rates among the ASEAN member states, despite the decrease of total live births of teenage mothers aged 10 to 19. In 2016, 200,385 to 100,083 in 2019, according to the Commission on Population and Development, or the POPCOM. The Philippines has recorded a 7% increase in births among girls aged 15 and below in 2019. So the Filipino minors who gave birth in 2019 increased to 62,510 from 62,341 in 2018. In 2019, 2,411 very young adolescents aged 10 to 14 gave births, or almost 7 every day. One in 3 births among minors occurred in the 3 regions of Calabarzon, with 8,008, National Capital Region with 7,546, and Central Luzon with 7,523 births. Outside Luzon, the highest number of minors who gave birth were in northern Mindanao with 4,747 cases, Davao Region with 4,551, and Central Visayas with 4,541. Each child bearing may result in poor health outcomes and may be a threat to the country's economic growth. Pregnant adolescents are less likely to complete higher education and have a lesser economic or lesser ability to earn more income over the course of a lifetime, so causing economic losses to the country. So according to the National Demographic and Health Survey, or the NDHS, in 2017, the Philippine Statistic Authority and the PSA, the percentage of young women who have begun childbearing is lower in urban areas than rural areas, 7% versus 10%. So young women with some primary education and those from the poorest household are more likely to have begun childbearing than young women with higher education levels and those from the wealthiest household. Pregnancy during teenage years is also associated with a higher risk of health problems such as preeclampsia, anemia, contracting STDs or the sexually transmitted diseases, premature delivery, postpartum hemorrhage, and poor mental health outcomes. Teenage mothers are more likely to experience violence and depression that can increase the risk of mental disorders. Mothers with poor maternal health are more likely to give birth to a low birth weight baby with inadequate complementary feeding and breastfeeding, frequent infections, and inadequate food, health, and care. The low birth weight baby will grow as a stunted child, a stunted teenager, and finally to a malnourished pregnant woman who in turn has another low birth weight baby, and the cycle persists through generations. Their body may compete with developing fetuses being cared for nutrition and may not be psychologically ready to nurse their babies after delivery. So since some pregnancy among teenagers is either unintended or unwanted, so lack of knowledge on nutrition can also lead to poor health outcomes. So pregnancy can be a perfect time to improve nutrition. Adolescents can relate to specific foods better than vague nutrients of which they have little knowledge. So pregnant adolescents have identified that nutrition messages should include information on eating appropriately for the baby's and mother's health. So offer advice on foods for physical comfort and emphasize specific foods rather than nutrients. So during pregnancy, the body goes through a lot of physical and hormonal changes. To feed your growing baby, you need to make great food choices from a variety of sources. Pregnant mothers, especially those teenage mothers, are recommended to eat a healthy and balanced diet that will provide them and their baby's need. The food you eat is your baby's main source of nourishment, so it's very important to get all the nutrients you need. So according to the World Health Organization, pregnancy and childbirth complications are the leading cause of death among girls aged 15 to 19 years globally, with low and middle income countries, so accounting for 99% of global maternal deaths of women aged 15 to 49 years. So teenage pregnancy is very serious issue. So this may the root of economic losses in a country and can cause serious incidents. If you know someone who had the same case as this, help them. Share the knowledge, particularly the parenting process. So some of the teenagers who are experiencing these cases, they also experience the stage of depression and anxiety that causes them to the misfortune. So always remember that teenage pregnancy is a very serious issue, in particular with the community and their families.